welcome back to Fox 5 Weekend Live. I'm your host, Saida Abbas. Time now is 11:41, and joining us now on this very cold and blustery Sunday morning is Dr. Mansi Kotwal, who is a pediatrician in our local area here in DC. Doctor, thank you so much for joining us.
Thank you so much for having me.
Absolutely. We have a lot of important things to talk about. We were obviously speaking about the weather, and right now we want to focus on ACA premiums, especially for our local DMV families who are always looking for healthcare options. So I want to start off talking about that. A lot of parents are concerned about that with premiums that are going up. What are you hearing from patients?
So the fact that the premiums are going up is actually going to be really, really hard for a lot of our families. A lot of the families I serve are underserved families that are already struggling between, do I pay for rent this year or this month, or do I pay for food for my children? And so when you're looking at premium costs going up, that's going to be another added kind of mix in the bag of, can I afford this coverage? Can I pay for healthcare for my child? Or do I have to focus on the food and the clothing and the water and the electric bills and all of that stuff?
And what's driving those increases?
Well, there's two things. So number one, premiums in general have risen a little bit, and that's really just because of the anticipated rise in healthcare costs overall by insurance companies. So if they're insured, or they're thinking that there's going to be more and more people that are left uninsured with the kind of expiring subsidies, if you will, then they just assume that more people are going to be uninsured, and therefore they're going to have to increase those premiums overall. But more so than that, it's actually the fact that the out-of-pocket costs for premiums are going to be higher with the fact that these tax credits or these subsidies are not going to be expanded or renewed.
And a lot of these local families that I was speaking of, they rely on marketplace coverage, right?
Yes.
So could these increases technically push them out of coverage?
100%. So you're going to have patients or families that are, again, not able to make ends meet in general right now. And then now when you have one more added expense, they're going to have to choose, right, between healthcare or food, healthcare or rent, healthcare or an electric bill. But you also are going to have families that, or even young, healthy individuals who may just choose not to have healthcare, right? Because why pay for that extra expense if they don't necessarily have to? And that was actually one of the reasons that the ACA was implemented in the first place. And so it will drive families, whether it's by choice or whether it's by forcing them out of coverage, for sure.
Absolutely. And lawmakers, I want to mention here, they haven't extended the enhanced ACA tax credits. So what does that lapse mean for low income and middle income families who were really counting on that support?
It's going to be a very difficult decision. So right now with open enrollment, they're going to be deciding, okay, am I going to have enough money for the next year rolling in healthcare if these subsidies are not expanded? And so I think it's going to be a really difficult decision right now. I do encourage, to sign up and please, please, please get insurance, because we don't know what's going to happen. But it's going to be a very difficult decision for these families.
And obviously a ripple effect. We want to talk about when coverage gets really expensive like this. A lot of individuals and even families, and this is very sad, they decide to skip out on treatments or getting coverage or going to the doctor. And it's very sad because they're just picking through, like, do I pay my bills or do I get checked out because I really need this? And what kind of ripple effect does that have on pediatric practices like yours? You're a pediatrician, and on hospitals in general.
So if you have families that are not able to or choosing to, miss out on their primary care visits, or like if we're looking at adults for, screening kind of preventions, whether it's your pap smear, whether it's a mammogram, whether it's a colonoscopy, you're going to have families, children and adults, that are going to come to the hospital sicker, right? So they're going to wait until the last minute. They're coming to the emergency room and maybe have a higher need for, an admission or higher kind of cost of healthcare from that perspective. But you're also going to be looking at patients that sometimes waited too long, right? And so there is really, really good data to suggest that if you do not have insurance, not only are you going to, eventually maybe get sicker, but your mortality rate is also higher. So it's not like an insignificant consequence that we can see. We are going to see a lot more patients that are coming to the emergency room, and they're going to be sick, and they're going to require more care. And that's really just because they did not have the money or the insurance to go to the doctor in the first place.
And again, this situation is going to also put a lot of pressure on our local doctors and those that are on the front line like yourself, How concerned are you that frontline providers are going to see that uptake in uninsured patients or families that, are waiting until they're in crisis to seek help because they can't afford to go for basic needs, and then the situation gets worse, and then they come for help, but then it puts a lot of pressure on those that are working on the front line?
100%. Our wait times in the emergency room are skyrocketing every year. It gets worse and worse. And so when you have more patients that are uninsured, more people that are coming to the hospital for care, to the emergency room, that wait time is just going to go higher. And on top of that, you're also going to have hospitals that are serving more and more patients that don't have insurance. And so hospitals in general do provide care for, a substantial portion of people that do not pay for it, right? So it's free care. And we're happy to do so, right, for families that don't have insurance. But the more and more that happens over time, you will see a ripple effect. And, hospitals are going to have to make the decision. Do I, continue my staffing the way as it is? Do I cut it? You're going to have safety issues that arise. You're going to have a lot of other kind of things that are problematic.
Is there any relief on the horizon? Is there anything Congress can still do in the short term? Or are families pretty much stuck until lawmakers really revisit this?
I think the biggest thing Congress can do is just say that they're going to expand the subsidies. Because that's really, that's something that has been there for several years now. It's implemented beautifully. It's in place. It's really, really easy to just say, we're just going to keep this, even if it's just for one more year. And if they want to do something else, if they want to come up with a different plan that might be just as, beneficial or whatever, that's fine, I guess. But the biggest thing is right now, it's a really, really, it's a difficult decision for families, and so if they can just expand it for this 1 year at least, if not more, that would be great.
Absolutely. Of course, a really important topic that we're going to continue to cover this year and next year as well. Now we want to transition into flu season. Yes. It's the colder months, the temperatures are going down. So doctor, let's talk flu season. What are you seeing so far in your practice, and are cases coming in earlier or more aggressively this year?
Yeah, so to be honest with you, I've seen a couple patients that have come in that have, either tested positive for the flu or currently sick and, missing school, missing work, that kind of stuff. We haven't seen, at least in the pediatric hospital, like an influx of people that are very sick or hospitalized just yet. But we have started seeing flu cases, and they are coming earlier and earlier every year, to be honest with you.
And we hear that hospitals already feel stretched out with everything going on. Premiums are going up. People are avoiding basic preventative care, like I mentioned. What does that mean heading into peak flu season now?
The ICUs are always full at children's, or at lots of children's hospitals and a lot of adult hospitals as well. And so when you're looking at stretched thin providers, stretched thin hospitals, and looking at a peak flu season that's going to start, especially with this new variant that has, kind of been shown to be in the UK and Japan and potentially will come to the United States as well, I think we're going to be stretched even more thin.
And I want to talk about vaccinations, especially when we're speaking on flu season. Are you seeing folks coming in for those? Are you finding families more hesitant to get them this year? Or are people generally coming in to get those vaccines that they need?
I will say that the vaccine hesitancy has become an increasing problem more and more every year.
Okay.
It is unfortunately the reality, since the COVID, pandemic and all of the kind of misinformation and things like that that has surrounded vaccine and vaccine hesitancy. But I think with the flu, at least, I personally, I take care of a lot of patients that have asthma, allergic disease, and some immunocompromised people. And so they usually are a little bit more inclined to get the flu vaccine.
Yeah, and a lot of parents are watching us right now. So, they're wanting to know, what signs should they look out for in their kids to bring them in before it gets really bad when we're talking about getting the flu?
Yeah, it's unfortunately the flu, it starts off with your common cold symptoms, right? So cough, runny nose, congestion, fevers. But if after a couple days things are not getting better, those fevers are rising, it's harder for that kid to, take in liquids by mouth, or just kind of you start noticing a little bit more struggle breathing, especially at night. I would actually try to get seen early just so you could get tested, potentially get Tamiflu, and, potentially get other kind of preventative stuff that you might need.
And why do you think there's always a fraction of people who don't really take flu season that seriously? And we're not asking folks to put on masks or, do anything extra, but why do you think some people typically don't come in to get the shot or get those vaccines?
I think, in reality, with the flu, the majority of people are going to be fine, right? So if you get the flu, and that's similar to COVID, it's similar to a lot of other respiratory viruses. But when you have asthma, when you have even one other underlying medical condition, you are going to be at a higher risk for getting more sick with the flu. And so when you have families that are you know what, my children don't have anything that is kind of a medical condition that could potentially make their flu virus or flu infection more serious, they themselves think that there's no reason to. And the reality is that the flu vaccine, one, can prevent hospitalization or at least reduce the risk of hospitalization and severe consequences, but two, it's a public health kind of effort, right? So you are trying to protect the people, especially the babies that can't get flu vaccines until 6 months, or people that are immunocompromised that don't respond well to a vaccine or can't get vaccinated for whatever reason. And so I can understand that kind of mentality for families that maybe have healthy children, and I think that's one of the big reasons. But you know, I do urge that, you know, get the vaccine if you can, and there's a lot of benefits to it.
I know. We also want to speak about how people can avoid getting the flu, right? Because when the pandemic was going on, we all were really, really good about, you know, being really cautious. Of course, it doesn't have to be that serious, but certain basics, you don't always have to just wear a mask, but like washing your hands. So what are some ways that folks can remember to take care of those basic needs to avoid getting the flu in general, ways to cope?
Well, stay home if you can, if you're sick. I understand that might be a privilege for some people, but wear a mask if you feel anything, right? Cough, congestion, fever, if you feel under the weather. It's easy to do. We have very, very, you know, very accessible to masks nowadays. And then washing your hands, just try to keep that 20-second rule, because that's really what's going to get the bacteria and the germs off of your hands. And again, we have lots of hand sanitizers all over buildings. And so those would be like the biggest ways.
Yeah, I know. During the pandemic, people were like definitely saying happy birthday a couple of times.
Yes.
That's when you know you've really washed your hands. So remember that. It's really important.
Yes.
And even if, you know, right now it's really dry season, so make sure you remember all of that. If there's one message, doctor, you want to give to families to hear about navigating both those rising healthcare costs that we spoke about and flu season, what do you want to leave them with today?
Specifically when it comes to the flu season, get vaccinated. Again, if you can, please get vaccinated. There's really good data out there for many years about the benefits of the flu vaccine. That's number one. And then number two, when we're talking about the rising costs of healthcare, I completely feel for my families that come in on a regular basis. And, you know, we screen people for food security. We screen people for a lot of different things that might be affecting their level of care that's not just a medical kind of a medical reason, but like a social reason. And so I would say that stay informed. Get your information from people that know what they're talking about. If you can, vote, please, because that is going to be, you know, the number one kind of driver in terms of getting people into office that care for you and that are going to do things that will make your life easier in the future.
Absolutely. And just one more thing. I think now with AI and ChatGPT, a lot of people have relied on that to get medical advice and become their own doctors at home. Before it was WebMD or something like that. So now a lot of folks are getting advice from a chat bot and getting advice on flu season or healthcare. And do you think that is good for you guys? It takes a little bit of pressure off from local doctors, but of course all that advice is coming from AI. So what's your take on that?
Well, it's interesting. I actually feel that a lot of people are getting their advice from Instagram and TikTok, and you know, ChatGPT it can be good if it's used correctly. I will say sometimes I have just kind of input things into ChatGPT, and I'm a little bit hesitant about some of the things that get spit out. So the biggest thing would be try to, if you are a social media user, try to maybe follow a healthcare professional that, you know, is, you know, evidence-based and says that they are. But if you're not a social media influencer, a social media user, try to research your topics on your own. So, you know, look for an article, look for something that, you know, you see in like maybe a headline news and kind of dive a little bit deeper into that. Because sometimes those ChatGPT things, they again, can be good, but they are sprinkled with some information that may not be factual.
Exactly. I mean, you want to get advice from professionals like Dr. Mansi Kotwal herself, who is a pediatrician. So where can we find you if you want to get some medical advice? Do you have a Facebook page or a website?
I do have an Instagram account. I don't do a ton of information on there. I do have a YouTube channel that is specifically focusing on, you know, kids that have allergies and food allergies and things like that. But